The number one concern early retirees in the US have is usually healthcare. When you retire before the age of 65, Medicare isn't an option yet, so you'll need to plan to cover your healthcare expenses. In this video, we'll break down your healthcare options after early retirement and also go over my mistakes and learnings in this journey so you will have a better understanding and gain confidence before embarking on this path. I'm Vinny, and I retired in my mid 40s last February from my technology role at a large corporation. My family of three had the most amazing healthcare coverage with the plan that the company offered. It was a high deductible plan with Cigna, where I could contribute, I believe, about $8,000 a year into an HSA account, which also included company matches. Now, it had deductibles of $2,500 per individual and $5,000 for the family, and had pretty much every provider covered. Now, I just didn't know how good I had it until I retired and had to figure out health insurance for myself. Now, let's start with your options. When you and your spouse retire early, here's where you can look at. One is COBRA, that's continuation of coverage. If you're retiring from a job with an employer-sponsored insurance, COBRA allows you to keep your current health plan for up to 18 months. But here's the catch. You'll pay the full premium, including the employer's portion, plus a 2% administration fee. Now, this makes COBRA one of the most expensive options. Option 2 is the ACA Marketplace plans. The Affordable Care Act, also known as ACA Marketplace, offers a variety of health insurance options, and these plans are often subsidized based on your income. Now, this is the most common route for early retirees who don't have access to an employer plan. Now, option 3 is private health insurance. Outside of the ACA, you can also explore private insurance plans, but they're typically less regulated and may not offer the same level of coverage. And there's a fourth option with health sharing ministries. For those with a lower healthcare budget, sharing ministries can be an option, but keep in mind these are not technically insurance and may not cover all your medical needs. I didn't even consider this as an option because it felt quite complicated and didn't feel like I would have peace of mind with it. Now, my initial plan was to continue with COBRA and in a few months figure out the right ACA or private insurance that would work for me. Now, this was until I got the sticker shock a couple weeks before my last day at work when I was informed that to continue my coverage, it would be a premium of $2,600 a month just for the health insurance, and the dental would be separate. Now, I thought this was way too steep. So my last 2 weeks at work were trying to navigate healthcare.gov to find a suitable plan, but it was so damn confusing and overwhelming. Now, I tried getting more info on YouTube, and many people there recommended using an insurance broker, just to help you navigate through the various plans and select one. So I went to my social network and received a few recommendations for health insurance brokers and spent some time on the phone understanding my various options. I highly recommend this. Don't waste your time navigating through healthcare.gov. These brokers, they get commissions from the marketplace and doesn't add anything to your premium, so it's free consultation for you. Now, I had calls with both an ACA marketplace broker and also a private insurance broker. I didn't go with the private insurance even though they offered PPO plans similar to my employment, but primarily because you had to undergo some tests to determine eligibility, and I didn't have time for that. They also didn't cover pre-existing conditions, and my concern was that if I developed a condition this year and I would have to renew next year, could they deny me coverage? Now, overall, I didn't get a warm and fuzzy from the private insurance options, so I went with the marketplace. Now, if you're wondering what is the difference between a PPO plan and an HMO plan, PPO plans are like the ones many people have through their employers. They offer flexibility. You can see specialists without a referral, and you're covered even if you go out of network, though at a higher cost. Now, HMOs require you to stay within a network of providers and get referrals to meet specialists. Now, most ACA plans are HMO plans. Now, when it comes to insurance options, even in the marketplace, there are so many different types of coverage for various things. So, unless you are in a very unique situation, the most common parameters you look at to narrow down your options are like monthly premium, deductibles, out of pocket max, and the provider network. Another thing you probably look at is copay, but the more parameters you add into your equation, the more difficult it is to compare the different plans. Now, in the marketplace, they have classifications of plans into bronze, silver, gold, platinum, which essentially their categorization is based on your deductibles and your monthly premiums. So, bronze plans will have lower premiums but higher deductibles, and platinum plans will have higher premiums and lower deductibles. Now, since I was used to having a high deductible plan, which allowed HSA contributions, I wanted to continue with something similar that I was comfortable with. So I went with the same in the marketplace. My HSA account had grown significantly in the past few years, and I saw huge value in having it and allowing tax free growth. So the plan I chose was the Baylor Scott and White high deductible plan with premiums of about 1060 a month with a deductible of $7,500 per family member and a $15,000 deductible for the entire family. And the out of pocket maxes was the same as the deductible. So basically, once I met my deductible, I also met my out of pocket max. So the math I did in my head was that I'd be paying about $13,000 in premiums, and the max out of pocket apart from the premiums would be an additional 15,000. So it would cap my healthcare expenses at 28,000. Now the math was fine, but what I did not anticipate was all the other complications. Now, my first challenge, a few weeks into retirement, I went to my dentist for a regular cleaning, and then I found out I did not have dental coverage. You actually have to pay for dental coverage separately, and it's not part of the ACA plan. So I paid full price for my cleaning and then called my broker to add a dental plan. I got the Blue Cross Blue Shield dental plan for the family for about $110 a month. This wasn't a big deal, but I didn't realize now that there are restrictions for any dental work. With the new plan, you have to wait 1 year with the new dental insurance before you can get insurance to pay for stuff like replacing a crown or something of that nature. So basically, for the first year, even though you have dental insurance, if you need a crown, root canal, or something more than a regular cleaning or filling, you either pay full price or you have to wait 1 year. Now, the second issue, my daughter was in the middle of orthodontic treatment. Essentially, she had braces and had to go for fittings and adjusting to her ortho regularly. The treatment was covered completely by our previous insurance, but not by the new one. So, even though it started during the previous coverage, I had to pay an additional $1,400 in the new plan. And this payment didn't even go towards our annual deductible since it is cosmetic and not considered necessary treatment. Now, the third issue, 2 months into retirement, one Sunday, my daughter was complaining about pain in her abdomen, and we took her to the urgent care facility, which was part of the network. Now, after a bunch of tests and a $4,200 invoice, they said they couldn't figure out anything and we should probably see a specialist. Yeah. $4,200 advice to see a specialist. But I had a $7,500 deductible per family member, remember? Now, here's where the problem actually started. We realized we couldn't just schedule an appointment with a specialist. We needed to get her primary care physician to recommend that she sees a specialist. This is how the HMO works. So we go to a pediatrician only to realize that her pediatrician is not part of the network. This was so frustrating. Now we go through the provider network and found a new pediatrician that was accepting new patients. So I made an appointment with her. We got one for like 3 days later. And on our visit, she tells me that since this is our first visit, it cannot be combined with a referral to a specialist request. If this visit is not just a checkup, but really a request for her to refer, then she would have to charge us for this visit. This was getting really irritating at this point. Yeah, finally, after paying her, we got to see the specialist. And everything turned out to be okay. But the experience and the delays was very harrowing and caused a lot of anxiety for us. Luckily, the issue wasn't very serious and the delays didn't impact my daughter much. But I wonder what would have happened if it was a more serious condition. The fourth issue, the mental effects of having such a high deductible plan. With a high deductible plan, apart from preventive care, you pay out of pocket for all your medical expenses until you meet your deductible. And the previous incident showed us that a routine visit to the urgent care can run up to thousands of dollars. So a few months later, I noticed my daughter wincing on her golf swing. When I inquired further, I realized that she had been having this discomfort on her wrist for a while and hadn't told me about it. And then I found out that she didn't want to have another $4,000 bill for a checkup and was hoping the pain would just go away. My heart sank when I heard this. We don't ever want our kids to hide injuries or pain because of what it might cost. And I guess she had overheard a conversation with me and my wife when we were just expressing a bit of shock at the previous urgent care bill. The purpose of health insurance is so you have peace of mind and can seek medical help when you need it. But if your deductibles are so high that it prevents you from doing so, then maybe it's better to switch to a different plan. Yeah, I switched to a zero deductible $2,000 max out of pocket for family member plan for 2025. It doesn't give me the HSA contributions option. It's a higher deductible at $1,400 a month, but it's giving me so much more peace of mind that we will seek medical help whenever there is a need to do so. Now, let me be clear. I am not blaming anyone but myself for the issues I faced. The system is what it is, and it was my job to understand it and take the right course of action that worked best for my family. But apart from general oversight, I overlooked procedural complications and mindset challenges that might arise from my choices. Financially, my choices were still okay since we stayed below the max healthcare expenses of $28,000 that I had figured out. But when it comes to your healthcare choices, it cannot be only financial considerations. Now, this is what I would do if I was starting over. Now, if I didn't have time to do my research prior to my last day at work, I'd just sign up for Cobra for at least 2 months so I can figure out the right plan for us. When choosing the plan, I'd go to a broker and pick a plan that has coverage with all the primary care providers for everyone in my family. That would be the first criteria. I would not go with a high deductible plan just for the HSA benefits. especially if the deductible was so high that it would impact your mindset of when to see a physician. And then for dental coverage, I would find a plan that continues coverage from my employer plan so I don't have to deal with this 12-month waiting period. Finally, a question many folks might have is about healthcare subsidies with healthcare.gov. So basically, if your modified adjusted gross income in retirement for the year is less than 4 times the federal poverty level, then you get subsidies in your premium. Now, for a family of three, this amounts to income being less than about $100,000 in 2025. Now, with my asset allocation, I do receive dividends, interests, real estate distributions. That pretty much will get me over that threshold for subsidies. I guess there are ways to reduce your income so you get the subsidies, but I don't think it's worth doing all of that for my situation. I'd rather do Roth conversions than try to get these subsidies. Now, healthcare choices after early retirement can be quite overwhelming, but with the process of elimination and some due diligence and help from a good broker, you can figure out the right plan for you. Do you have additional questions about healthcare after retirement? Drop them in the comments below. If you found this video helpful, give it a thumbs up, subscribe, and share it with someone who's planning early retirement. Until next time, take care and happy planning.